Dr. Farmer. So please take us away, Dr. Farmer, and thank you again.
Of course. Well, thank you guys for having me. It's a pleasure to spend this next hour with you. As you can see, I did this presentation. I do an annual Parkinson's program during Parkinson's Awareness Month every April, and this was in the 2018 program. And it was the one program that we actually had to cap attendance because we could not fit any more people in the room. So we capped it at 150 patients and care partners. And that is the interest and the curiosity and the desire to know more about medical marijuana has not gone down from that point. It is something that everybody has questions about because it's familiar. It's something that everybody has an opinion about because it's familiar. And hopefully during the next, half hour to an hour, you'll get your questions answered and see if this might be a nice adjunctive therapy for you for certain things related to Parkinson's disease. So let me advance. Okay. Ooh, how do I advance?
You can use your forward and back keys, should work.
There we go. Okay. So there is the fact. There is no evidence to support medical marijuana is effective for Parkinson's disease. And that is true. The evidence is lacking. And as a matter of fact, there is evidence to suggest that marijuana and the cannabinoids can have a negative effect on the utilization of dopamine. But those are all in animal studies or in what we would call in vitro and in vivo studies that doesn't necessarily take into account the benefit that it might have in the human brain. And we also know that there's a lot of anecdotal evidence. So I would like to qualify that statement that says there is no large blinded trial evidence to support medical marijuana is effective for treating the motor symptoms of Parkinson's disease. So that's a qualified statement because we do know that there are things that can be treated by medical marijuana that might be helpful because Parkinson's is more than just motor symptoms. So I would present the statement as there are preclinical studies, multiple surveys, and anecdotal evidence to support medical marijuana is effective for treating the non-motor and hyperkinetic symptoms of Parkinson's disease. Non-motor being the depression, the anxiety, the sleep, and the pain. Hyperkinetic meaning the dyskinetic movements and things like that. So medical marijuana, some basics. The cannabis plant has species with over 100 pharmacologically active compounds, and it has been used for millennia. One of the fathers or grandfathers of neurological management is Dr. Gowers. And in the 1880s, he described in his Manual Disease of the Nervous System that there was benefit of using medical marijuana in patients with movement disorders. His description is of a patient, however, that had a shaking of the right arm after an accident. Now, this isn't necessarily Parkinson's disease, but it is a movement disorder. And looking back on it in hindsight from the 20th century and the 21st century would be that this might be a movement disorder that is the result of trauma. And those movement disorders may be based in anxiety or post-traumatic stress. Again, anxiety and increased stressors can be the non-motor symptoms of Parkinson's disease. So if he was shown that the utilization of this compound was effective, not necessarily for treating the tremor, but for treating some of the context in which the tremor occurred, the anxiety, things like that, then that again is supportive in a roundabout way, but supportive of a potential use in the non-motor symptoms of Parkinson's disease. There are two types of cannabis, sativa and indica. Sativa has more THC, indica more CBD. THC and CBD are the compounds that have the therapeutic benefit. THC is the psychotropic compound, so that's the one where people are worried about if it makes them high or can have them have the side effects of paranoia and the munchies and things like that. CBD is the one that is utilized more effectively in medical marijuana because that doesn't have those side effects present, or if they are present, they're present to a much lesser degree. And you can have cannabinoids like you can have any other medication. They can either occur naturally or they can occur from synthetic reproduction. Or they're ones that we make ourselves that are already in our body. So the endocannabinoid system is what it's called, is pretty complex, just like the dopamine system is pretty complex. There are dopamine receptors in multiple places, not just the brain. So are there cannabinoid receptors. So I put this on as a joke because this shows the complexity of the dopamine system, which I also put it on because I think if people automatically come out and dismiss something as not being effective, are not giving the respect to the dopamine system that it deserves. So just because on the surface, one type of medical marijuana or one type of cannabinoid may have a negative impact, when you have a species of well over 100 to 500 different types of potential possibilities for therapeutic benefit, there is obviously some place in these systems where it might be helpful and beneficial. So I say this not because I expect this to be useful to anybody, but just to give a perspective as to how complex the things that are going on in your brain and throughout your body are. So how it impacts Parkinson's disease mostly is that we know that in the brain, there is a high density of these endocannabinoid receptors in the basal ganglia. And the basal ganglia is the real estate that is most impacted in Parkinson's disease. That is the part of the circuit for movement that works primarily with dopamine, and there is a disruption in the utilization of dopamine in that system that causes the freezing, that causes the tremor, that causes the stiffness, the slowness, rigidity, things like that. So the primary types of receptors in the basal ganglia are CB1 and CB2, CB1 primarily. And these receptors impact the chemicals that we just mentioned, dopamine primarily, but there are two other chemicals, glutamate and GABA. Glutamate and GABA are also impacted by some of the medications that you take for Parkinson's, whether they be muscle relaxers or medicines that are used to dampen down the excitability of the system if you have dyskinesias or things like that. So glutamate and GABA are some of the excitatory chemicals and the inhibitory chemicals that work alongside dopamine to help keep the balance for movement. The endocannabinoid system is also involved in regulating serotonin and norepinephrine. This is important because if in any talks that you've seen or research that you've done on your own, you know that dopamine is a precursor to other chemicals in the brain that impact serotonin and norepinephrine. Serotonin is primarily involved in mood. Epinephrine is your flight and fright, your adrenaline, your get up and go. So when you are low in dopamine, you are low in all of these other chemicals. And because of that, that is why there are the non-motor symptoms. Some issues with anxiety, some issues with depression, some issues with apathy and lack of interest and desire. So there's a chemical reason for the symptoms that you're experiencing, and the endocannabinoid system may have an impact on these as well. So the opinion, because marijuana is well known, is what do you think of somebody when they smoke or have in the past thought of somebody that smokes marijuana? And this is something that might pop up from time to time. Medical marijuana is not the same as recreational marijuana. Now, people's first exposure, patients and otherwise, might be through recreational marijuana. Somebody had it, somebody tried it, they wanted to see if it helped, and it might. That is not the same chemical compound that medical marijuana is because of that THC and CBD ratio. So the goal is not to make you more slow or more mellow or more like feeling as if you are high or loopy or anything like that. It is meant to dampen down some of the symptoms that you are having, but not with the cognitive effects that can sometimes be seen with recreational marijuana. So a little bit of the history. Back in 2003, the Health and Human Services Department of the United States granted a patent which listed the use of cannabinoids found in the sativa plant in neurodegenerative conditions, including Parkinson's disease, Alzheimer's disease, and HIV. So they realized back then that this would likely go on to have some sort of potential medical implication for management. By 2030, the number of people with Parkinson's disease will be approximately 9 million worldwide. For those 9 million people, we have about 10 drugs. And most of those drugs work pretty well, but we know that their impact and their symptom control are not effective for all things. And where they lack the most is in the non-motor symptoms, because most of the drugs that modulate levodopa are studied based on their improvement of motor symptoms. Tremor, rigidity, slowness, things like that. We do not have things that are as rigorously tested specific for the non-motor symptoms. So when options become available, I do think that they are worth a look to be educated upon and to learn more about to see if they're a viable option for patients. In the search for neuroprotection, there is some preclinical animal models to suggest that cannabinoids can reduce oxidative stress, which may have a potential benefit. There has been shown to be improvement in neuroinflammation. That does not mean that medical marijuana has the indication for neuroprotection. So if you are hearing that medical marijuana or cannabinoids, over-the-counter CBD or anything like that has the potential to be disease modifying, that is an overreaching statement. Is research being looked into it? Of course. Neuroprotection is an active area of research for every aspect of neurodegenerative diseases, but we do not have anything as of yet to say that it is. The other thing that's important to realize, and I talk about this with my patients all the time, since we only have about those 10 drugs to use, we do have to probably repeat something that was tried before and either was not effective or there was a side effect that was associated with it. The reason is, over the continuum of Parkinson's disease, your brain chemistry changes at different stages. So what was effective or ineffective before may be effective or ineffective now. So when we go back to revisit things, it's not because we've run out of ideas. There may be a reason that you respond differently to it going forward. And likewise, if you're no longer getting a benefit to some medication, it's not necessary to continue to stay on it because our medications are for symptomatic management. That it does not mean that there is any neuroprotective benefit to what we have as of yet. Early on in the course of the disease, it's more of a malfunction and a desensitization of the receptors that you have or the neurons that are available. But in the moderate and advanced stages, it's actually the loss of these neurons and these receptors. The real estate blueprint is getting less and less because you have less and less of these neurons that are available to utilize the drugs that you are taking. The CB1 receptors that we were talking about before that are mostly expressed in the basal ganglia have an impact on those chemicals that we were talking about before, GABA, glutamate, and cholinergic. Those are the excitatory and the inhibitory chemicals of the brain, which is why you can get that either reduction or the dampening down effect of certain things, whether it be anxiety or something, or pain or things like that. They have similar structures to the dopamine receptors that are also there. So its effect on dopamine, its direct impact on dopamine may be inhibitory, which is important to mention because when we are talking about, is this going to be something that helps with motor symptoms? Maybe not. We don't want to inhibit more dopamine. We don't want to block it in any way. So if people are touting medical marijuana as a treatment for tremor, it may be anecdotally helpful in their case, but primarily what they are looking at dopamine to help with are the non-motor things and not the motor symptoms, because based on some evidence, it should say that it would have a negative impact on motor symptoms. Now, I have a number of patients that will tell me that it really does help their tremor. It's just short lasting, much like the way alcohol can help a tremor, but it's short lasting and there might be a rebound effect. And that's just something we talk about and we take a note of. But I do not typically say that medical marijuana should be used for treating motor symptoms of Parkinson's disease. So when talking about tremor, the reason why it might have an impact is because tremor is actually quite complex. It's the same reason why some patients with Parkinson's disease that have tremor predominant symptoms, no matter how much dopamine you give them, which we know should work and impact tremor, it doesn't have an effect. And that's because tremor is not modulated by dopamine alone. It has other chemicals that are involved with it, dopamine, serotonin, and norepinephrine, nor is it simply corralled through the basal ganglia. There are other areas of the brain that might also have an impact on tremor. So while tremor is the most common symptom associated with Parkinson's disease, it's also one of its most complex. In a 2004 study in the Movement Disorders Journal, 339 patients were surveyed. 46% with the use of medical marijuana felt an overall improvement in symptoms. 31% found an improvement in resting tremor, 38% in rigidity, 45% in bradykinesia, and 14% showed an improvement in dyskinesia. A more recent study in Colorado showed that they found most improvement in the non-motor symptoms of Parkinson's disease. So that 46% and the 45%, the improvement in bradykinesia and the improvement in the general overall management of Parkinson's, I think correlate well with just a general improvement of oomph, that people felt a little bit better on it. Was it because they felt a little less anxious? Was it because their pain was a little bit more modulated? Was it because they were sleeping better? Oh, I think I've been forgetting to mention sleep. Of course, medical marijuana can absolutely be helpful in sleep fragmentation and things like that. So there is evidence to support the 31% improvement in resting tremor and the 38% improvement in rigidity. Again, I address tremor with a grain of salt all the time. However, the rigidity I do think is something that can be helpful because rigidity is an overactive muscle contraction, and one of the things that the medical marijuana can do is help with relaxation in that regard. It's also used for spasticity, which is different flavors of rigidity, not the same thing. They come from different abnormalities in the brain and the neurological pathways, but their endpoint looks quite similar to a patient. It's just a stiff, tight, increased tone of a muscle. How does one take medical marijuana? So the way that you can ingest medical marijuana varies by state, and it varies by what the different dispensaries have available. Smoking is probably the least common route. It's more often edible or tincture, which is like a little dropper of a solution under the tongue. It can be vaped. It can be applied topically, but very few places, not very few, it's increasing, but probably the least common way of doing it currently is actually getting dried leaves to smoke. Patients have said that over the oils and the extracts, inhalation has the most robust effect, and that makes sense, given that it doesn't have to go through the GI tract and that absorption into the bloodstream would be quicker through the lungs, which is why that new medicine that's currently available in Bresia is an inhaled form, because again, it bypasses the inhaled form of levodopa. It bypasses the GI tract and gets absorbed directly through the capillaries of the lung and the alveoli of the lung. So there is some evidence that it can improve psychosis. I, again, would not recommend that we try medical marijuana for the treatment of psychosis. I do not think this would be a first-line therapy or even a second-line therapy, maybe a Hail Mary last-ditch effort, but there is just far too many concerns that go along with psychosis and cognition and utilizing something like medical marijuana. There are now medications specific for psychosis and Parkinson's disease like Nuplazid, which I would absolutely suggest before trying something off-label like medical marijuana for it. So, and the question about the dyskinesias, again, because it's a motor symptom, there have been some positive studies by way of survey and observation and some negative studies. It's not inappropriate to try, but if there are other more established medications to consider or medication adjustment strategies that might work, such as either reducing the amount of levodopa if you are able, or bringing on board amantadine or its newer formulations like Gocovri or Osmolex, that would definitely be the way to go before trying medical marijuana. 50% of people with Parkinson's disease experience pain, and I have no qualms at all suggesting medical marijuana for pain and Parkinson's. And the reason for that is because pain is one of the symptoms that we have good data on in other areas, whether it is in other neurodegenerative conditions or whether it's in primary pain syndromes. We do know that medical marijuana, both in ingestible and a topical form, can be helpful. Same thing with anxiety. Not necessarily depression. Depression, though, and anxiety are flip sides of the same coin. But if you fall more on the anxiety component, again, I have no qualms suggesting medical marijuana as a viable alternative, because I still think antidepressants are necessary. But if you're using as needed medications like benzodiazepines, Klonopin, Ativan, Xanax, things like that, which are beneficial and helpful in Parkinson's disease, I think the potential for side effects and concern with use of those medications is no different than any potential concern for side effect that you might see with medical marijuana. Again, sleep. Much like I said before, I have no problems or qualms suggesting medical marijuana to potentially help with sleep. Because what do I currently use for sleep fragmentation in Parkinson's disease? I typically use Klonopin because it also treats REM behavioral sleep disorder. While REM behavioral sleep disorder may or may not improve with medical marijuana, sleep fragmentation very well might. And that is another big hurdle and symptomatic concern for patients with Parkinson's disease. And again, since I'm already using a medication like a benzodiazepine, I think medical marijuana is on par with any issues or concerns for side effects that you would be seeing with that. So there was a question prior to starting if ataxia could be benefited by medical marijuana. Not necessarily, because ataxia is actually one of the concerns for the side effects. So medical marijuana is a depressant. It slows things down. So it can cause worsening memory. It can cause balance issues. It can cause dizziness. So things that might already be impactful for a patient that has Parkinson's, if these are problems, then it doesn't mean that medical marijuana can't be used, but it has to be used logically and under the watchful eye of family and physician, because we want to make sure that we are not worsening any of these other potential conditions. The concern for addiction is low, and that is because how it is formulated with a higher CBD to THC ratio. So while that is something that may or may not come up, though I do have to say none of my patients have really asked or have been concerned about the addictive properties of it. I do want to reassure that the concern for addiction, given the higher CBD ratio, is lower than it is for recreational marijuana. So the question is, if you think that you have some of these non-motor symptoms that may benefit from medical marijuana, would you like to try it? So how do you go about getting it? And in the states where it is legal, it is a registration process. And for our symposium, we were in the state of New Jersey. So I went through it for the state of medical marijuana application in New Jersey, but it really is not much different for other programs, whether it's Pennsylvania or something else. The Department of Health for your state, like if it is approved in your state, likely has a component of their website dedicated to the use of medical marijuana and how to obtain medical marijuana. And you can see that there is different designations for patients and physicians. You need to find a physician that is licensed to be able to prescribe medical marijuana. That doesn't necessarily mean that it is your neurologist or your movement disorder specialist. Hopefully it might be somebody in their practice so you're not going in blind. But in some places you do need to seek out a physician that is not part of your routine care who is licensed to dispense medical, or not dispense, but to prescribe medical marijuana. And I will say that if you do have to go outside your inner circle of who has been part of your medical management, do your due diligence, because while states might have registries of physicians who are licensed to prescribe, see what types of specialties those physicians are in. I would avoid the pain management docs. They're not going to really have much by way of understanding of how to use medical marijuana in a Parkinson's patient, and it might be a little bit more of a mill. I would look more to palliative care docs or geriatric doctors that are getting licensed in medical marijuana, because they likely have some understanding of chronic neurologic conditions and are better able to answer and answer questions and be suited to the concerns that you might have. Once you have found a physician, you also, or not once, but in conjunction with finding a physician, you also likely have to register yourself to get a license. So that cost is a different amount of money in different states. There are some states that have different tiers of cost based on socioeconomic scale, based on veteran status, based on disability status, things like that. And these are all things that would be available through the website or by calling the Department of Health and asking about your state's medical marijuana program. The way that you then get enrolled is different. So I am licensed in both New Jersey and in Pennsylvania, and it's actually different in those states, and they're right next to one another. So in New Jersey, a patient comes in and sees me. I determine that I think they have a symptom that would benefit from medical marijuana. I fill out a clearance form for them. I print it out at the visit. It has a registration number. They then go and register themselves. And then once they get their license, they take my clearance and their license and go to a dispensary. And at the dispensary, they discuss the type and formulation of medical marijuana that would be most beneficial for them for the symptom that they're trying to manage. All my clearance does is provide clearance and provide an amount of medical marijuana that can be distributed over the course of 3 months. I have no determination of the type, of the ratio, of the form. So that is something that is discussed at the dispensary. The dispensaries are staffed by individuals that have a knowledge of medical marijuana, but they themselves may not be a medical professional. They may not be a pharmacist. They definitely are not a physician. So if you see a dispensary, go to a dispensary, and are not comfortable at the dispensary, you are not tied to that dispensary if you do not purchase from them. You can say, thank you very much for this information, and then go and see if there is someplace else that you feel more comfortable. In the state of New Jersey, there is a list on the website of all the different dispensaries. There is also a patient network. So by word of mouth, patients tell patients where they feel they have gotten the best care, their questions answered mostly, ease of accessibility, and things like that. They do limit the number of people that can go into the dispensary at one time. So sometimes if I've had patients go with family members, only the patient and whoever they designate as their care partner for this purpose is able to go in with them. It cannot be a room full of people. The same for that is true in Pennsylvania. The same thing. My clearance is just that, a clearance. But the difference is in Pennsylvania, patients need to register themselves first, and then I, as their physician, certify their registration. So it's a slightly different process. And as I said, this is varied state by state. So it is something that you would have to do a little bit of research on your own. If you are fortunate enough to work closely with a physician who is already licensed, then they can help you work through this. So this is just the website for medical marijuana in New Jersey, and this is the one for Pennsylvania. So I can skip through those. Oh, I'm stuck. Okay. So in summary, cannabinoids in the basal ganglia are involved with neurotransmitters that are key to Parkinson's disease symptoms. Primarily, they're non-motor ones. Pain, sleep, and anxiety seem to be what is most consistently improved based on survey studies and anecdotal data. And given the high ratio of CBD in medical marijuana, it appears to be relatively safe. So I would say that if this is something that you are curious about, you can always look to over-the-counter CBD first to give it a try. Same thing though, there are many variations and many strains. So I would go to some place that is reputable so you can speak to them first about what it is that you're exactly trying to manage. And if one doesn't work, another one might. If you've done over-the-counter CBD and have not found it effective and you're curious about medical marijuana, I would definitely encourage you to speak to your provider about it. If your physician poo-poos the idea or says this is not something that should be used in Parkinson's disease, then I would say maybe do a little research and look to see if you can have a conversation with a different doctor about it. Because while they're going back to the very first slide, while there is no direct evidence that it will help, there is definitely enough anecdotal evidence to support that it might be a possibility. And when we're using medications such as benzodiazepines or higher dose pain medications or things like that, that can potentially have the similar side effects that make people wary about medical marijuana, I do think it's unfair to just completely dismiss it as a possibility. So it is not something that you should use in lieu of other medications that have been more established and more effective, but it's definitely something that can be considered as an add-on or as something that might be helpful to address some of the symptoms that you might be having that are inadequately managed. So in summary, that is my little spiel on medical marijuana, and I believe it's about time to open it up for questions, if that works for you guys.
Yes, thank you so much, Dr. Farmer. So I'm going to try to combine a few questions that I had. They were all related to the fact that on a federal level, marijuana is illegal, which makes it difficult or makes it impossible to have a federally funded study. And people had questions relating to, well, why don't we do an international study, or should we lobby our Congress people, or, you know, could there be an exemption? So could you talk about that aspect relating to, you know, large scale research?
Sure. So I was actually part of a symposium that was put together by the National Parkinson's Foundation out in Colorado, which brought together people from all areas of neurology that have the potential for treatment with medical marijuana. So neurodegenerative conditions, patients with seizures, things like that. Also included there were basic scientists, and also included there were legislators. And what it boiled down to was, you're absolutely right, because it is illegal federally, there is no plan to change the federal legality status of medical marijuana. But what they are looking to do is the horse is out of the barn. So they have thousands, if not tens of thousands of people in the country, and even more worldwide, that are already using medical marijuana to treat symptoms. So while it won't necessarily be the purest form of research, by looking at a compound, seeing how it works on different receptors, and then bringing it to this compound works on A symptom, B symptom, C symptom, it's essentially like reverse engineering and looking at what patients are on, finding a trend for the strains that work best for those particular symptoms, and then going back to see how that might work chemically in the brain. Now, the clinicians in the room felt that this was an absolutely fine idea. The basic scientists in the room felt that this was blasphemous and that this is not how you should conduct drug research. And everybody was right. The problem is we have to work in the context of the current climate and what we have available to us. So ignoring the data that is already potentially out there to be collected, I think, is foolish. And so they are looking at companies that are having basically using the equivalent of crowdsourcing information. And they are already available where you can enter a database, put the type of medical marijuana that you are utilizing and the symptoms that it is helping with, and the as specific as the ratio and the strains of what is involved in it. And people will have access to go onto that database to see what is utilized for different things. And that also scientists can go onto those databases to see where the trends are and see if they can narrow their search a bit more. Because like I said, there's well over 500 different potential compounds and species of these cannabinoids that can be looked at. And while it sounds not necessarily as purely scientific, the reality is there are many medications that we use that we don't truly understand their mechanisms of action for, but we do know that they're effective. To get back to the idea of lobbying, any lobbying is good. If you have a voice, and patient voices are some of the most passionate out there, if you have a voice and can get the ear of someone that is in even a small seat of power that can then go up the chain to larger and larger spheres of influence, then it is something that would not be an unjust cause, because the more people see that this is something that patients are interested in, not just out of curiosity, but because it is potentially helpful. And then they can, not that everything needs to be brought down to numbers, but if they can then equate that to an improvement in health outcomes and utilization factors and reduction in some of the other medications or some of the side effects that are being utilized currently with different medications or being impacted currently with some of the other medications, then those are tangible things that will get even more and more people on board with getting more and more research done.
Absolutely. That's a powerful message. Let's see. We have a couple questions, and if this isn't something that's within your expertise, then I think maybe we can try to arrange a follow-up program. But there were a couple of questions about crossing state lines and travel, and for example, if you're using medical marijuana in a state that allows it and then you travel, do you have to bring documentation? And I already look, people already think I'm drunk. I worry if then I'm carrying, marijuana, then I will be, unjustly persecuted. Do you have any expertise when it comes to travel and documentation?
Sure. So you would travel with medical marijuana the same way that you would travel with any medication. Keep it in the container in which you got it. Keep the packaging and any documentation from the dispensary that you have with you stating that it is in fact medical marijuana, as well as your medical marijuana license. So you have everything that you can use to support that this is something that you're using for your own personal cause. If it is a tincture, if it is a liquid, it is something that will have to, and you're traveling in an airport or something like that, it's the same way that you would do, reconstituted insulin or something. They have a special way of managing it, simply because it is, because of the questions about legality from state to state. If you are licensed to carry it, then it is able to be on your person and your person alone. Do not give it to somebody else to hold for you. Do not do anything like that. I haven't had any issues with people that have had it confiscated or anything in that regard. But I would say, depending on the formulation that you have, keep it in the most official looking packaging possible. If you are given leaves, do not put the leaves in a Ziploc bag and carry that with you, because that is just not something that is going to fly. But if it's in the packaging from the dispensaries, then it should be fine.
And so this is somewhat related. And again, I give you, free pass to punt if you don't know. But this attendee says if they live in a state where medical marijuana is not legal, they go to a doctor where it is legal and then take it back to their home state.
So that I honestly don't know. That is something that I would punt to either a legal affairs person or somebody that's up on the advocacy. I'm not sure. I know that patients can see a provider who is out of state from medical marijuana, but they have to have a Like, so if I'm in Pennsylvania and I'm licensed in Pennsylvania and I'm licensed in New Jersey, my Pennsylvania patients can come and see me in New Jersey, but I could not prescribe for them if I wasn't licensed in Pennsylvania, because the only way to obtain a license on their behalf is to go to a dispensary is to have any evidence of residency in the state where they would be getting their medical marijuana from. So even though we're just across the river from one another, someone from Pennsylvania can't come to New Jersey and someone from New Jersey can't go to Pennsylvania. But they can see me in the office of wherever I am. They just can't pick up the medication other than the state in which they live.
Okay, very good. And yes, I think a follow-up with someone on the legal affairs side of things is absolutely something that we'll look into. Next question. My neurologist discouraged using medical marijuana because she said it's hard to ensure a quality product at the dispensary level. What are your thoughts on that?
So there is no federal regulation at the moment, obviously, and it is just as if you would take any other supplement. Supplement is more CBD. Medical marijuana is slightly more consistent in its ratio of what you are going to have in whatever formulation you get. But that doctor is right. There is no federal regulation for it. That has not been a reason why I have discouraged patients, because I have a number of patients that go the homeopathic or their naturopathic route anyway, and there's no regulation for those things either.
That's a good point. If you're okay trusting your, vitamin, or wait, not vitamins, but your a herbal pill or something like that, or maybe some vitamins as well, then with enough research, again, I think it's just because of the history and the association as a recreational drug, we kind of look at medical marijuana with a different filter.
Sure, but like I said, you are in control of what you put in your body. So if you do go to a dispensary and you just don't like it, don't get your marijuana from that dispensary. Go and do research, get patient feedback and point of views, and see where they feel people are most knowledgeable and most capable of being able to answer your questions and make you feel most comfortable. So it is not as regimented as your CVS, where you're going to get the same medication if you go to one CVS versus another CVS by any stretch of the imagination. But there is definitely ways to try and check and balance where it is that you're going with the information that is currently available.
Okay. The next question has to do with the placebo effect. This person says, I hear a lot of anecdotal stories about the benefits of using medical marijuana for sleep and pain, but these same people have recommended other supplements that I see as snake oil. I've heard that the placebo effect is strong with people with Parkinson's, and I just have concerns. So I guess that's not really a question, but maybe if you could talk a little bit about that placebo effect, and specifically with people with Parkinson's.
Sure. In every drug that you take for Parkinson's disease, the placebo effect in those clinical trials can be as high as 30%. The difference is it's not sustained. So after a tincture of time, that the return of symptoms will come back and you will start to see the effectiveness of the placebo be less, because there is something chemically that the drug is doing that is making a difference. Same thing with medical marijuana. You might very well get a placebo effect in the very beginning, but if it was truly helping, then the placebo effect would wear off. Whereas the patients that were feeling that they were getting a benefit, it would be more sustained with time. And that's really the only way to tell the difference. But placebo is not bad. I mean, we use placebo effect to our advantage. when your doctor is talking to you and telling you and kind of building up the idea of, let's give this a try. It has the potential for it to be quite beneficial. I've seen people use this and it has helped with X, Y, and Z. They're not quote unquote selling you, but they are trying to put you in the best frame of mind to have the best potential outcome with the things that they're recommending. And that's building upon the placebo effect.
I love that perspective. I mean, if you're a researcher, the placebo effect is a bad thing, but if you're living with symptoms, it's a good thing.
Right. It is. If it helps you, it helps you.
I love that. Let's see, we had some questions about lung issues, but you covered that, and I didn't know that actually, that the least common form is smoking, and you can use edibles or tinctures or vape or topical. One of our attendees in the Southwest in Yuma, Arizona, which is a border-ish town, chimed in that she went to a Border Patrol info meeting. And if you go through a U.S. Border Patrol checkpoint, it will be confiscated. So that's a good FYI for those of us who travel along border highways to be wary. But I think, Dr. Farmer, just your blanket statement, treat it like any other medicine. It was prescribed by a doctor. I think that's a great way. It's nothing to be, defensive or ashamed of. It's a medicine, just like your Cinemet.
Yep.
And I had a question about, well, this is more of a comment. I've tried medical marijuana. I don't have problems with sleep. I don't like how it makes me feel sleepy. I feel like it triggers my apathy. Is there anything you want to comment about, apathy and medical marijuana?
So that would not be one of the things that we would typically use medical marijuana for, because like I said, medical marijuana to some degree is a little bit of a depressant. So we do tend to expect it to slow things down a little bit. So we don't necessarily want to slow down someone who's very apathetic even more. It is, I would say though, that if they were still curious, to try, that would be a conversation to have with someone at the dispensary saying that they might like something a little bit more stimulating. And in that case, they might switch the ratio a little bit from the CBD to a little bit more THC or vice versa. So as I said, there's thousands of combinations that can be tried. It's a matter of your interest in doing the experimentation, your financial limitations, because all of this is still out of pocket. To see, but it's not for everybody, just like other drugs are not for everybody. So if you did try it and you gave it a good shot, and you don't feel like it's beneficial for you, then it's not something that you need to continue to pursue.
Yep. And to go back to what you said, you're in control of what goes in your body. Advocate for yourself, take control. I had another question. When analyzing risk benefit and using CBD with 0.03 milligrams THC, and it helps for sleep, does getting sleep in the end make it more important than the issues you mentioned about disturbing the dopamine production? That's a doozy of a question. Go for it, Dr.
So that I would say is, if it works for your symptoms, go for it. Because like I said, the studies that have shown that it's a problem with dopamine production have all been bench work studies, like animal studies, preclinical data, like all of that sort of thing. So I'm not saying that that should be forgotten, but I'm saying that that might be why it's not as effective for motor symptoms as for the non-motor things. So if it's working for sleep and it's helpful for you, you're using it for an appropriate symptom, I wouldn't worry about the theoretical potential on dopamine production.
Got it. Okay, Sam had a question. Balance is one of his motor issues. He's tried edibles with 10 milligrams of THC and it helped with sleep and pain, but it made the balance worse. is worse. Is that anything we're talking to the dispensary and, asking their recommendation? Or do you think maybe that Sam has proved it's not good for his situation?
Yeah. No, well, it should never even be considered for balance. For the other symptoms that he mentioned, absolutely. But balance, no. And if it does make balance worse, then it's that classic risk-benefit conversation that you have with your patients about, is the benefit that you're getting better? Is the benefit that you're getting enough so that we need to address the side effect? Not the only thing, but the thing that helps with balance most in Parkinson's disease is exercise and activities that check and retrain the brain for balance. And then when that is not enough by itself, then utilizing an assistive device to give you an external cue to help with balance checks.
Okay. A follow-up question, and I am keeping an eye, we're coming towards the end of the hour. What is the half-life? If I take it at night for sleep and pain, then will it wear off by the morning when I want to go to my exercise class?
So that very much depends on the type of medical marijuana that you're using, but usually medical marijuana can be dosed up to 3 or 4 times a day. So if you're only taking it at night, it should be out of your system for a sedative effect by the time you get up in the morning.
Okay, very good. So maybe, Sam, that's something where you just work with your timing, and there's a lot of variables: dosage, the particular type the blend, how you're taking it. And I think, like you said, Dr. Farmer, if you're up for it and financially, it's something that works, because it's all would be, paid for out of pocket, right?
Yeah. Yep.
Yes. Okay, let's see. Let me scroll through and make sure I didn't miss anyone's questions. Okay, someone said, does using CBD oil have any psychotropic effects?
It should not.
Okay. And let's see. Okay, and looks like we got everyone in the so this is a tough question, but maybe you can take a stab. Is everything that you said, does everything you said equally apply to essential tremor? I have essential tremor, not Parkinson's. That's a tough one, Dr. Farmer.
That is a tough one. And because I would say that I don't typically recommend medical marijuana for tremor in Parkinson's, I likely would not recommend it for tremor in essential tremor. That said, we do know that alcohol helps essential tremor, and propranolol, which is an when used for before presentations or before doing a test or before going out on the stage, it's used for some situational anxiety components. So medical marijuana may be helpful if you notice that some of these strategies, whether it be alcohol or whether it be propranolol or something like that, or Ativan, can help with the tremor. So I wouldn't discount it. If you were in my room, I would say, what else has worked for you or not worked for you in the past, and it might be worth a shot, but it would not be a full endorsement by any means.
Okay. And this last question is maybe a good way to end. My movement disorder specialist has spoken negatively when I've asked about using medical marijuana. I love my doctor. I don't want to contradict them. How would you recommend having this discussion in a respectful way?
Sure. I would ask why they discount it. Listen to what their rationale is. If it sounds reasonable, then every clinician is entitled to their opinion of how they like to treat and manage their patients. If it sounds like it's just an arbitrary blanket, no, I don't think this is good. I don't think it has any potential benefit, and I think the side effects may be worse than the whatever you're looking to help it with, then I think that might just be an uninformed or an unappreciative approach because they either don't want to get involved with the rigmarole of prescribing it or they just have no interest. So kind of see what your gut is telling you about it. But if you have a good relationship, ask. And if you do get a response that you're not satisfied with, say, listen, you've been my doctor for quite some time. We have a great rapport and I value your information, but this is something that I really would like to give it a shot. Would you be opposed if I did seek out a provider that was licensed in it to ask some questions? And no doctor should ever quell anyone's curiosity for another opinion. No doctor knows everything, and I think that that would be extremely respectful way to bring it up. And I have patients that we have these conversations with for other things, and I think it's just fine. And if you have this wonderful relationship with your other provider and they're accepting of you being able to look at this outside of their practice and still coming back to talk to them and educate them about it, then it would be a win-win.
Very good. I think that that's great advice, and I think those of you who have a great relationship, a long-term relationship with your neurologist, like you said, Dr. Farmer, if you're approaching it in that, respectful way, then, have a conversation, advocate for yourself, and who knows, maybe you might even push your physician to do some additional, maybe they would be motivated to do some additional research. And the Colorado conference that you mentioned, there's starting to be more, more research and more resources, I should say, for physicians to refer to. So any final words to wrap it up, Dr. Farmer?
I would just like to thank you all again for having me. I hope that you found this informative and answered your questions in a way that will be useful for you. I can't overstress the idea of advocating for yourself. So if this is something that you feel strongly about, please have the discussion with your doctors. And if you find that they are not educated on it, bring in information to help educate them, and then see what the response might be. If it ultimately comes down to it's something you want to do and you don't feel like you're getting the support, then look to resources like the PMD Alliance, the National Parkinson Foundation, and others that have a list of providers that specialize in Parkinson's, and see if you can get your questions answered elsewhere.
Love it. Great way to end. And there were some questions that we didn't, get to address because they were, more legal questions.
Sure.
So what we're going to do is look to set up a follow-up, a part 2 program. So some of those questions about employment drug testing and crossing state lines and whatnot, so we can get a true expert, from that perspective to chime in on this as well. So
Sure.
Stay tuned. But thank you all for joining us, and thank you for all the great questions. We really appreciate your time and expertise, Dr. Farmer. This can be a tough topic to get quality information on. And I know that Dr. Farmer's video wasn't working today, but I always like to wrap up our online programs. Those of you who turned your video off, if you could turn it on so we could all wave at each other and get some eye contact and see each other all across the country, tuning in and being part of this little online community to learn and connect. So thank you all for joining, and we'll see you. I hope you tune in next month and check our website for the recording if you want to watch all that again and soak it in again. There was such good information.
Thank you.
Thank you. Bye now, everyone.
Bye-bye.